Hello everyone and welcome. Today will be the very first day that you will be doing your clinical rotations in the oncology department. Today we will be closely interacting with patients who have been diagnosed with leukemia, and more specifically with acute myeloid leukemia. Forgive me, I forgot to introduce myself. My name is Raquel Manjares. Legally, Raquel Stephanie Manjares Mena, but let's just go with Raquel Manjares today. We don't need the whole alphabet now, do we? Okay. First things first. We don't want to go into the department not really knowing what we're talking about now, do we? So, leukemia. What is it? Good. It's a cancer of the blood. However, there are 4 types. There's acute lymphatic, acute myeloid, chronic lymphatic, and chronic myeloid. These are categorized by 1, how rapidly they spread, so fast or slow. Fast would be acute and slow would be chronic. And myeloid and lymphatic refer to where the cancer has started, the region. Leukemia is a malignant and progressive disease. What does this mean? This means that it is a cancer that reproduces very quickly and it spreads to nearby regions rapidly. And it also has the ability to target, invade, and destroy nearby perfectly healthy cells. And there is a high number of leukocyte cells. Signs and symptoms. Okay, let's get one thing out of the way. The difference between sign and symptoms. Symptoms are something that the patient feels yet cannot be accurately measured, such as, oh, I have a headache, I have a stomach ache, things like that. And signs are evident, it's concrete. You can see it with your eyes. So someone breaking out into a fever, you can see the sweat, a broken bone, a rash, things like that are categorized as signs. So signs and symptoms of AML. Also today we will be specifically talking about AML because we have such a limited time frame. Tomorrow we will pick up with chronic myeloid leukemia. Today, let's focus on AML. Things to look out for in patients would be weight loss, fever. They become more prone to infections, have a loss of appetite, fatigue. Because it is a cancer of the blood, their ability to form blood clots has been compromised. So if and when they do get a cut or any injury that results in an open wound, the patient might report difficulty clotting, also experience weakness and night sweats, easily bruised, they're also confused, and anemia. Because these are common symptoms and signs that can be found in a number of other diseases, it's suggested to run blood work. What are the causes of AML? Well, for starters, family history has a lot to do with this. So if your parents or your siblings have had leukemia, it's likely that you are also more prone to developing this disease. Also, if there is a history of blood disorders in your family. Frequent exposure to radiation is also a contributing factor. So if you work in the radiology department, you are required to wear the best way I can describe it is a magnet, either on your scrubs or on your badge. And what it does is it changes based on how much radiation you've been exposed to, and once it reaches a certain amount, it's time for you to remove yourself from that setting, or you just wear the proper PPE that you need in order to be working in that environment and keep the distance. Another cause would be frequent exposure to benzene or formaldehyde, other chemicals, etc. Being a frequent smoker also contributes to AML. Because AML is a cancer of the blood, it does affect your immune system, and you could develop neutropenia or thrombocytopenia, or you could also become anemic. Excuse me, I have a sore throat. Okay, let's talk about the pathophysiology. So in this, the red blood cells are or the cells, they're replicating and multiplying. However, sometimes the cell doesn't fully go through with the process and becomes a mature cell. So the cells are just dying off, and that's when you have a decreased number of red blood cells. Or in the other scenario is that the cells are reproducing, however, they are defective and they're not healthy cells. So now you have a surplus of abnormal cells that are multiplying at a very fast rate, and they are targeting the nearby healthy cells, destroying them, invading them. So now you have a surplus of leukocytes in white blood cells, and it leads to a surplus in organs such as the liver and the spleen, also found in bone marrow. How do you diagnose AML? Of course, since it is a cancer of the blood, it is very logical to run blood work and do labs. So one way to diagnose it would be through blood tests. A licensed professional such as a phlebotomist could draw a sample of blood and run it to the lab, do some tests, check for the white blood cell count, and also search for abnormalities in the blood cells and their shape and deformities under a microscope. Bone marrows, samples, and biopsies can be taken, and those are evaluated by a pathologist. They specialize in finding abnormalities within tissues and other samples. Another way to do so would be through imaging. Again, a pathologist or radiologist, actually, they evaluate the images and get a diagnosis from there. Another way that you can do it would be through genetic testing. So this specific type of testing, you are looking for the genes and the proteins that are directly involved with causing leukemia, and this would help out if you just found out that someone in your immediate family has been diagnosed with leukemia, with AML or another form of leukemia. It could help you see if you also have the genes to develop the disease, and it'll just give you a head start with treatment planning and another form to diagnose AML would be through a spinal tap. In this case, the physician collects a sample of cerebral spinal fluid, and this sample is collected from the pelvic bone in the back, so in the lumbar. How do you manage and how do you treat acute myeloid leukemia? So we have what is called a multidisciplinary team, in this is when different doctors come together to form the best treatment plan for their patient. This team consists of physician assistants, oncology staff such as nurses, oncologists, the techs to, obviously work the machines. Of course, pharmacists to figure out what medications would work best and to make sure that there isn't any mixture of medications that shouldn't go together. And dietitians. So you can treat acute myeloid leukemia with blood transfusions. You could also do chemotherapy, and this is when you're using drugs to target cancerous cells. And chemotherapy and radiation, the patients going through treatment for cancer, their hair falls out, and that is because while they're receiving treatment, that treatment is targeting the cells that are reproducing rapidly within their body, and hair cells are also those cells. Despite being healthy cells, a treatment can't distinguish the difference between cancerous cells and healthy cells. So what happens is that the hair cells get caught in a crossfire and end up being targeted and killed off, as well as the cancerous cells. There is also targeted therapy, where you target the proteins or the genes in specific areas that allow the cancer to grow in. Leukemia it's malignant. However, say that we were talking about a cancer that was benign, then you could get surgery and have the tumor removed by a surgeon. And depending on how much they were able to dissect and remove from the patient, that determines their treatment plan, whether they'll need some radiation or chemotherapy. Also, chemo causes the patients to feel nauseated, so they can be prescribed medications for that, such as ondansetron, along with other medications to treat the symptoms. Prognosis of AML. So after being diagnosed with AML, studies show that 1 in 4 adult patients live longer than 5 years after being diagnosed. And depending on your age also has a lot to do with your chances of survival. So people who are in the age group of 20 or older, which would be myself, and that age group's prognosis would be a 26% chance of survival, whereas for an age group that is younger than 20 years, their survival rate skyrockets to a high 68%. So yes, definitely AML is more deadly in the older populations. However, it's not really that common in people who are over the age of 45. Okay, in 2020, research showed that there were 60,530 patients who were diagnosed with leukemia, not just AML. This is referring to all 4 types of leukemia. There, in that same year, there were unfortunately 23,100 deaths tied to leukemia. Again, not limited to AML. There were, that same year, 19,940 new acute myeloid leukemia diagnoses. This is tying into the 60,000. So of those 60,000, 19,000 were AML. and it was mainly adults that made up that number. Of those 19,000, unfortunately, 11,180 patients died from AML, and most of them were mainly the adult population, the older population. Again, as I've previously stated, acute myeloid leukemia is not as common in people who are over the age of 45. However, it is slightly more common in men, and research on this is still going forward. It is being theory that this is linked to a sex chromosome. Excuse me. So the pathology and anatomy writings, the earliest relating to AML, have been linked to Alfred Armand in the early 1800s. He wrote about this disease in his medical literature. He wrote about a 63-year-old florist. The patient's gender wasn't listed in the article that I read. However, it was revealed that I'm so sorry. It was revealed that Alfred Armand examined her blood, and upon doing so, he found that it was of a thicker consistency than regular blood, along with a certain clumpiness. However, he wasn't very sure at what he was looking at or what his findings revealed. However, the term leukemia had already been coined, so he categorized it as that, just simply being leukemia. Later on, Wilhelm Epstein was actually the first to distinguish acute and chronic leukemia. It's because of him that one of the ways that in which we categorize leukemia is on how it progresses, whether it's rapid, which is acute, or whether it's slow pace, in which case it would be chronic leukemia. Newman was the first to actually use the location of where the cancer starts to categorize the type of leukemia. He was the first one to use the term myeloid, hence the acute myeloid and acute lymphatic, etc. Research on AML. Okay. It has been, through thorough research, it has become more evident that there is more than one type of AML. Doctors use a treatment plan to determine how aggressive they should be, and depending on which type of AML, how aggressive or how less aggressive they should be. And it aids in making a better prognosis. New tests are being developed to detect even the smallest traces of leukemia after treatment. And these tests are a lot better than regular bone marrow exams, because bone marrow exams don't pick up nearly as much as these new exams do. A clinical trial currently underway is one of the CAR T-cell therapy. In this clinical trial, the physicians and the scientists working the case, they remove the T cells from a patient with leukemia. They take it to a lab and they modify it and adapt it so that it can pick up CARs that will help it attach to leukemia once it has been placed in the patient again. However, this is again still barely a clinical trial, and the side effects being seen so far are that immediately days after being infused with the lab cells, the patients have experienced a really high fever or an extremely low blood pressure. So really quickly, two famous people who have been diagnosed with AML are Mary Travers. She was an American singer-songwriter, and she passed away at 72 years old because of the treatment side effects. And Rich Cronin, he was in the hip-hop and pop group called LFO, and he passed away in 2010 due to a stroke secondary to his leukemia. So the medications that he was on after receiving a stem cell transplant actually led to his stroke, unfortunately. All right, class, that's going to be it for today. Let's get ready for rounds, and I hope that you all absorb this information. Thank you.